One special unique aspect of otolaryngology is that we're very interdisciplinary. In other words, we're not just one body part. Everything I do in the voice and the throat has a lot to do with the nose and the sinuses and allergies and the head. All the nerves that go to the head and neck are important in the functioning that we bring to our daily life, such as ability to communicate, express emotion to those around us. Otolaryngology in the children population, between the idea of chronic tonsillitis and ear tubes and the development of language, the development of swallowing in infancy, these are all really important aspects of what every doctor sees. So I'm very proud to say that otolaryngology has an influence almost on every specialty that we interface with.
I think the most meaningful part for me is every day when patients leave their house, they're interacting with the world. Their face is what they're doing it with. That's kind of their introduction to the world each day, and whether it's an elective surgery or whether it's something they didn't have control over, like a skin cancer, getting them to feel as comfortable and confident in themselves is truly meaningful.
I love the fact that I get to do different things every day. Every day is different from the standpoint of patient population versus what surgeries I'm doing, what procedures we're doing. So every day is new and keeps me on my toes. It's enjoyable.
The biggest thing that made me decide I wanted to come here is that I have the opportunity to treat a complex and diverse set of health issues while working in a relatively small, close-knit group of physicians and other otolaryngology team members. So specifically, what does that look like? I can easily bounce ideas off of or talk with my non-pediatric colleagues or my pediatric colleagues in other subspecialties, and there isn't a wall or some sort of barrier to doing that.
Our department gets together and works together better than any I've ever been a part of. So we're all able to kind of lean on each other and support each other and also enhance each other's practices, because everybody has their own little niche and their specialty, and if you happen to have a question, there's always somebody to answer it.
I grew up in a small town in central New York, and I felt like Geisinger and Danville had the same sort of values. And when I was working with the residents and the department here, everyone really had that shared sense of camaraderie, and that translated to the patients as well. I think they know that in this region, coming to Geisinger, you're going to get great care, and this is the go-to medical center. It's an honor to work here.
Geisinger is very unique because it's a large health system that is in a very rural area. So most health systems of our size are going to be found in a big city. But coming to Geisinger, you have a really unique population of people that you get to interact with, but you do it in a setting where you have comprehensive quaternary care so that you are really able to take care of the patient from the beginning to the end of their journey, and you are able to keep all of that care in-house.
I've worked in several cities. I don't think there's been any other place where you feel as appreciated by your patients as in a setting such as this. There's the need, but then the patient's also extremely grateful for what you do for them. If you're willing to do a good job, you're honest, and you're kind to your patients, I think you can be successful here.
We really have two philosophies in our department. One is that no one should be bored in our department, from the nurses to the medical assistants to the physicians to the residents, because there's always more to do. And we expect everyone to grow through their career, which is taking on new challenges and having new achievements at every phase of your life. And the second is that no one is alone in our system. No matter where you're working in our system, we're not a hub and spoke model. We're a department that has 10 clinical sites. We operate out of 7 clinical sites. We care for about 1.3 million people in our catchment area, 105,000 clinic visits a year for unique patients. And no one is alone. At any point in time, we've got someone that has a specialty that can take on the new challenge, whatever the patient's needs are.
I think even though Geisinger is in a small town, this is a high-level advanced facility that, particularly when I'm speaking about pediatric ENT, there's nothing that we can't handle here. We do collaborate with bigger institutions like CHOP down in Philadelphia, but the honest answer is most people who come here and most kids who come here don't need to go further from home. And I think because they can stay in an institution that's a little more community-oriented, certainly more accessible, It allows us to really build those relationships better, which is fundamental to actually how even surgeries go. You know, the better relationship you have with your providers and with your team, the better you're going to feel about things. The proof is in the pudding that actually outcomes are better, you know, when that happens. So we have the luxury of being small, but playing like a big player, and that's unique. And it's actually a very valuable quality that Geisinger has.
One of the things that I would tell people that are thinking about joining us here at Geisinger is that they are well supported here, that we have a long-standing, stable department with colleagues that are willing to step in and help you become a young, busy, active surgeon. And so we're able to allow them to grow as they see fit in their career.
My biggest advice is just remember that growth mindset that we all start medicine with. Medicine is a practice, and we go into medicine because we love the idea of lifelong learning. And my advice would be to remember that that is the norm and that you will continue to learn and grow, and be excited about that.
I've been trying to inspire a culture of inquiry and discovery. That means that we're not just here for patient care or personal growth. We're here to understand our community better, figure out how to do things better, and aim for ever-improving outcomes, shortening the patient journey, getting better quality of life, lowering costs so it's more affordable for patients and for the health system to care for more complex disease over time. Part of that is research, and research leads to innovation. And we're fortunate that Geisinger has something called a Clinical Research Fund. They also have escalated opportunities for intramural funding to be able to fund pilot projects. Our department has an increasingly stronger commitment to mentoring junior people to take on these research kinds of projects. I myself have 4 or 5 different projects in the offering right now that we're percolating through to present at national meetings. And the more that we present at national meetings and that we're part of this national discussion, the more we at Geisinger are recognized for being innovators in engaging with our community and understanding our population and improving the composite health of our population as we take them through the journey to the future.
Geisinger has been extremely supportive in terms of my professional growth. During the time that I've been here, I've advanced my career by getting my master's in health administration, and that was something that they were very supportive in. And after I attained that, they were very supportive in getting me involved in a more administrative way, so that I sit on multiple committees. I'm a part of the conversation from an administrative standpoint. I work very closely with all of our surgical colleagues to help optimize our time in the operating room and to help our health system evolve in a way that's practical and makes sense and really utilizes everything that we can to be the best surgeons that we can.
I sit on the editorial board of the Laryngoscope, which is our primary journal. I get invited to give talks overseas. And at this stage in my career, you know, I've pretty much achieved everything I've wished to achieve for myself.
We want you to grow, we want you to take on new challenges, and we want you to feel the support of your teammates to be able to be successful at that.